Welcome, my name is Peter Strong and I provide a Skype counseling therapy service for anxiety and depression. I provide online psychotherapy via Skype for treating anxiety and depression without using medications. Medications may have their place, but they do very little to change the underlying cause of your anxiety and depression. And most people that come to me for help have already tried medications, they've already tried traditional talk therapy and not really seen much benefit. And that's because these approaches don't often really address the underlying cause of anxiety and depression. Talking about your emotions is not particularly effective for healing the underlying causes of anxiety and depression, or addiction, or OCD, or agoraphobia. I see many people who suffer from agoraphobia, of course, because they can't leave home, so they need to see a therapist online. So in mindfulness therapy, we really try to focus on the underlying cause, the underlying process that actually generates anxiety and depression and other emotional conditions. And the primary cause is really, it's to do with reactive thinking, patterns of habitual reactive thinking that we just blindly become identified with. This is the main problem. We essentially lose consciousness and we become controlled by patterns of conditioned reactive thinking. And this is what we really have to get on top of through good psychotherapy like CBT, or cognitive behavioral therapy, or mindfulness therapy, which is what I specialize in. So we have to work with these thoughts. We have to learn how to break the habit, basically, that feeds your anxiety or depression. And the way that I go about this is by teaching you how to meditate on your thoughts and on the emotions underneath the thoughts. It's really important to develop this conscious relationship with your thoughts and with the underlying emotions. And there's no better way of doing that than deliberately focusing conscious awareness on those mental objects. And that is the definition of meditation in my teaching. So rather than trying to run away from our anxiety or depression, or trying to stop thinking, which of course is not possible, we actually work on changing our relationship to our thoughts and emotions. We make it more conscious. Now, with consciousness comes choice. The two go together. Just as with unconsciousness or habit, there's no choice. So with the choice that comes with consciousness, we can begin to change our relationship and learn how to sit with our emotions and with our thoughts without becoming controlled by them. We can train to maintain balance. We can break free from their power, from their grip. And that's a training. That's something we train in, and that's what meditation really is. It's a training in how to be with your mind consciously, so that you're not out of control. So that's the first part of mindfulness training, is learning to break free from the influence of emotions and thoughts and memories and so on. The second part is helping the underlying emotions heal themselves. So the anxiety underneath anxiety thoughts needs to heal, and the depression underneath ruminating depression thoughts needs to heal. That's the fuel source essentially for the reactive thinking that feeds the anxiety or depression. So we have to heal that emotion underneath. We have to take away the fuel source. And we do that by developing a very conscious and very friendly relationship. And the emphasis here is on developing friendliness or compassion. You must develop a friendly and non-fearful relationship towards your emotions. That is an essential requirement for healing. They will not heal if you have any kind of aversion towards your painful emotions. They need your conscious, friendly attention, and that's what we generate during meditation. We learn not only to sit with our emotions without reacting, but we learn to develop a compassionate relationship with them, which helps them heal. There are lots of other things that we do in the mindfulness therapy approach to promote healing. The emphasis is on healing. We're not trying to change beliefs or thoughts. We're not trying to replace negative thoughts with positive thoughts, because that generally just does not work. What we're trying to do is heal the compulsive energy that is fueling those negative thoughts. You take the fuel source away, the thoughts dry up, and they become naturally replaced by more positive thoughts. The mind will naturally move in a positive direction if it becomes freed from conditioning. It's the reactive habitual conditioning that keeps us in a negative, fearful state. If you'd like to learn more about mindfulness therapy and you'd like to get help, through Skype counseling online for working with anxiety and depression, then please contact me and let's schedule a Skype counseling session so you can see for yourself how effective mindfulness therapy is for healing anxiety and depression, and also for recovery from addiction and many other common psychological, emotional problems. So please contact me if you want to learn more and you want to get started with online mindfulness therapy. Thank you.